everybody. So this is the short tips information video about what to do if you chip, break a tooth or filling or crown comes loose. This seems to be a common thing which patients in general across the country seem to be happening to them, and they're very concerned about what to do. So often a little chip is absolutely fine. Yes, it does feel rough on the tongue, and I fully appreciate that is not ideal. Unfortunately, it wouldn't constitute a dental emergency for us to treat, but there are some things which we just want to make sure patients are doing if this does happen. Number one is making sure that you keep the tooth and the surrounding gum area exceptionally clean, because if a little bit of tooth can break off, then there can be a gap between the neighbouring teeth. Food can get wedged in and cause some inflammation and irritation of the gum. So make sure you are brushing, you're flossing, you're using interdental brushes to keep that nice and clean. If a bit of tooth or filling comes off, it can expose the underlying tooth as well, so that can also get sensitive. So what I would say is when you're brushing, make sure you spit, you don't rinse, keep the toothpaste on the teeth after you've brushed. And you can also take a tiny little pea-sized amount of toothpaste on your finger and just rub it in around the tooth and leave that to settle overnight. You can do it 2 or 3 times a day as well. For other larger fractures or cracks, things which may have come off, you can actually get temporary filling materials from a pharmacy. So this is one which you can get from Boots. Okay, it's quite a common one. Different pharmacies, you can buy it online, Amazon, whatever it may be, and it comes with most of them come with 3 different things. There's eugenol, so many of you would have known that, something if there's pain, there's discomfort, and you can place it and it helps settle things down. There's a temporary filling material, which is kind of the consistency of a blue tack versus sort of putty, that kind of thing, and you roll it into a little ball. Again, pea-sized amount, and quite crudely you need to sort of squeeze that and squash it into the tooth where the gap is. They're not the most durable things, so they can fall out, so don't stress too much about it, but obviously it is an option should you be worried. The final thing, it does actually come with a temporary cement in these as well. It's very straightforward. You take it out and it's pre-prepared, and it comes with a little spatula in these things where you just sort of mix it and you place that inside the tooth. Now, if your crown were to come out, for example, okay, so here's an example of a crown. You can see there's the gap inside, and that's where you want the cement to go, okay, on the inside to fill that up. But before you place the cement into the temporary cement into the crown, if it's come out, make sure your tooth is clean. Try to remove any debris, any loose debris from inside the loose crown, because we want to enable a temporary cement to fit in. I would then also encourage you just to try the crown in 3 or 4 times, or as many times as you feel necessary, to make sure you're fitting it in the correct way round, because often patients can orientate it incorrectly, especially when you're looking in a mirror, because things are in reverse in the mirror, and also making sure that it does actually fit down. So we want to make sure if you are going to place it back on the tooth, it does fit down correctly, because it's actually worse to place the crown on incorrectly than to leave the tooth exposed, because that can lead to other problems. Of course, if you have any problems or if you're not sure, please message us, please email us, and we can even FaceTime you and talk you through the procedure if necessary. The other one is I've had, over the course of this, across the practice, has been patients whose crowns have come out which has a post inside of it as well, not an implant, but a post inside the crown. I would encourage you not to try to replace this, because there is a risk of this fracturing a tooth if you do it incorrectly. So while of course it's not ideal with regards to having a gap, the bigger risk is actually potentially cracking the tooth. So I hope that's helpful. Again, any questions, any problems, please email us and we will do everything